I mean, the premise of the article is like we're super excited about the opportunity for machine learning in healthcare. And one of the things that we discovered when we started looking at, what the possibilities were is that a lot of the data that you have in healthcare is really still siloed in the EMR. And so you have a lot of billing data and diagnostic data. And that kind of data is good for some things for machine learning, but really doesn't enable healthcare to have really a robust, self-driving moment in the same way that machine learning is helping to propel the self-driving car and autonomous car vehicle industry. So if you think back 10 years ago in self-driving cars, there really was no such thing as a concept of a self-driving car, and it was really these large government studies that were millions of dollars to try and get a car to drive short distances. And really the presence of data was what catalyzed that movement in self-driving cars, where you could get a lot of data about the environment and about mapping. And the problem we have in healthcare is we just don't have that kind of data about patients when they're out on the street in a way. We have a lot of data about what happens inside the four walls of the hospital, but not a lot about what happens to patients when they're not in the hospital. So you can think about like the difficulty of, let's say all you had was shop maintenance records of a car and fluid level measurements, and you tried to train a self-driving car off of that data. You can't do it. You need a lot more of a robust data set. And so that's really what we've been focused on, is helping to capture that data set of how do patients interact with the health system when they're between visits, and using that data set to in the future be able to help augment and eventually maybe start automating care for patients.